Hi there, Dr. Bruce Pinker here to talk to you about skin cancer. May is Skin Cancer Awareness Month, and the purpose is to prepare us for the upcoming summer and our exposure to the sun. You can get skin cancer on your feet. It's important to check your feet for any unusual skin lesions. You can actually get it under the nails. Subungual melanoma can occur, and we'll talk about that. So have your feet checked by a podiatrist if you think something is not right. And every year, you should have an evaluation by your dermatologist from head to toe to check for any unusual skin lesions. So I have some important and interesting facts and statistics from the Skin Cancer Foundation about skin cancer. So did you know that skin cancer is the most common form of cancer? And this is in the United States and even worldwide. And 1 in 5 Americans will develop skin cancer by the age of 70. If you have 5 or more sunburns or a real blistering sunburn, your chances of developing melanoma, a type of skin cancer that we'll talk about, it doubles. So we have to take good care of our skin and avoid the sun. But the good news is, if it's detected early, the 5-year survival rate for melanoma is 99%. So most people will survive if it's detected early. In the US, more than 9,500 people are diagnosed with skin cancer every day. And more people are diagnosed with skin cancer each year in the US than all other cancers combined. So now let's talk about non-melanoma skin cancer. Well, basal cell carcinoma is one of those types, and it's the most common form of skin cancer. About 3.6 million people are diagnosed in the US every year with basal cell carcinoma. Then there's squamous cell carcinoma, the second most common type, and about 1.8 million Americans are getting this every year. People who undergo organ transplants, like heart, liver, kidney, well, they're 100 times more likely to develop squamous cell carcinoma than the general public. But the good news is that we can prevent squamous cell carcinoma by about 40% if we simply use sunscreen with an SPF of 15 or higher. So now let's talk about melanoma. So less than 5% of all skin cancers are melanoma, but it's very lethal. And the melanomas account for more than 75% of the deaths from skin cancer. There are an estimated 186,000 cases of melanoma that will be diagnosed in the US this year in 2023. And in the past decade, from 2013 to 2023, the number of new invasive melanoma cases diagnosed annually has increased by about 27%. There are an estimated approximately 8,000 people that will actually die, unfortunately, from melanoma in 2023. This is very unfortunate. Of those, there's about 5,400 men and over 2,500 women. The vast majority of melanomas are caused by exposure to the sun. Only 20 to 30% of the melanomas are found in existing moles, while 70 to 80% of them arise from apparently normal-looking skin. So there are 4 main types of melanoma that you should know. The first one is called superficial spreading, then there's nodular, there's lentigo maligna, and acral lentiginous. So acral lentiginous is actually the one that we believe took the life of Bob Marley, the famous musician, when he was only 36 years of age. He passed away in 1981. He thought he had a bruise under his toe, supposedly, but it was actually a melanoma lesion, and he didn't address it. So very unfortunate. And so for melanoma, we have to know about the warning signs. There are 5 things to look for. We call them the ABCDEs. First is asymmetry. If you have a skin lesion that looks unusual, where one half is different from the other half, it's not symmetrical, it could be melanoma, and it needs to be evaluated by a doctor. B is for border irregularity. If you have scallops or poorly defined borders, the edges of the skin lesion look a little irregular, well, that needs to be evaluated and perhaps a biopsy should be performed. If the color is different from one side to the other, red, brown, black, well, then that skin lesion should be checked. It could be melanoma. And if the diameter of the skin lesion is greater than 6 millimeters, then it could possibly be a type of melanoma. They should be checked, evaluated by a dermatologist. If it's on the foot, come to a podiatrist and have it biopsied if necessary. We also talk about the E, which is evolution. If the skin lesion is changing from year to year in color, shape, or size, it should be evaluated and perhaps biopsied, because the changes mean there could be something that's taking place that could mean there's a malignancy. So let's remember, sun exposure, a major cause of skin cancer. We need to avoid it. And so we should apply the sunscreen 30 minutes before our exposure to the sun. And after swimming, you should reapply it as well. And some of us say that, we should reapply the sunscreen every 2 hours while we're outdoors. So let's keep that in mind, that the sun, we need to take care of ourselves with. We need to avoid the sun at all costs. So let's remember, summer's coming up. Let's be safe. Let's use our sunscreen and avoid the sun if we can, and have a very fun and enjoyable and safe summer.